Wow. The biopsychosocial approach to supporting children with special needs. The speaker is Dr. Lai Fong Hua, consultant child and adolescent psychiatrist, cognitive behavior therapist, and family therapist.
Hello, with me is Indrani, my wife. She'll be helping me read my slides as I have a visual impairment.
Biopsychosocial. There are 3 circles.
The approach to helping anyone with mental challenges or children with special needs in a holistic way would be a biopsychosocial approach. If we imagine a stool with 3 legs, so a biopsychosocial approach is an approach that looks at each part of the child and how we can support the child through each of these areas.
Common diagnosis in children with special needs. 1, ADHD.
The listed of disorders here are the commoner disorders that we see in our clinic. Children with special needs in the majority falls under these categories.
2, ASD or autism spectrum disorder. 3, learning disorders. 4, tic disorders, and 5, associated emotional difficulties.
Okay.
Behavioral and educational intervention are the first line treatment.
Before I go on, medication is not the answer to helping children with special needs. Medications are only adjuncts or things that we can add to support. So the main line, the most important support is actually behavioral and educational intervention for children with special needs. So the focus should be more on behavioral and educational aspects of how to help children with special needs.
Neurobiology of common disorders.
So talking about the biological aspect of supporting children with special needs, why biological? Partly because children with special needs, a lot of the difficulties actually comes from the neurobiological causes of the difficulties.
ADHD.
We will first look at ADHD or attention deficit hyperactivity disorder.
Disorder of regulation, and then you have the diagram.
This slide actually summarizes for us the difficulties that a lot of children or teenagers with ADHD experience. ADHD or attention deficit hyperactivity disorder is actually a disorder of regulation. So the area of the brain that is affected is the prefrontal cortex. It's an area of the brain in the frontal lobe. And in this area, scientists have found that the prefrontal cortex in children with ADHD are actually smaller compared to normal children. And what happens is the PFC in children with ADHD is actually less hypofunctioning, less able to carry out its function compared to normal children. That's why children with ADHD are less able to regulate their own emotions. They are less able to control their behavior. They're less able to focus. So it is a brain difficulty that caused the child to have this difficulty.
You have the picture of the policeman.
In layman terms, when I explain this to parents, we usually tell the parents that the PFC acts like a policeman. Okay, it's a policeman for the brain. So in normal children's brain, the policeman is doing their job properly, but in children with ADHD, the policeman in the brain has fallen asleep. So there is no regulation in the brain. So it becomes quite chaotic. The child can't sit still. He runs everywhere. He doesn't listen to what the teacher says. So one of the medication that we use, which I will tell you later, is actually to wake the policeman up, to stimulate the policeman so that the policeman can do his work.
This is the ADHD brain.
Okay, this is just a picture of the ADHD brain, which is actually found to be quite different from the brain of normal children. So ADHD is actually the problem of development, neurodevelopment. So a child who is hyperactive and who can't sit still is not naughty. He's not purposely trying to make life difficult for the teacher. It's just that the brain doesn't have the ability to regulate itself. Next.
Autism spectrum disorders.
We come next to a also very common cause of diagnosis seen in children with special needs, the autism spectrum disorder.
A picture of the brain, a graphical representation of non-uniform growth patterns in the autistic brain.
Okay. So just like the brain of children with ADHD, the brain of children with autism spectrum disorder is also quite different from children with normal brain of normal children. Okay, there are abnormalities in the brain in the area of the gray matter and the white matter and the corpus callosum, the wiring that connects the left and the right brain. Next.
Brain activation of autism and control groups.
So scientists are still doing a lot of research into how the brain works, especially in children with autism. And these are just some pictures to show you what is being done at the moment.
Learning disorders.
Okay, next. In the same way, children with dyslexia, with learning disorders, scientists have also found that the brain of such children also are different. Okay, so learning disorders are also just like ADHD and ASD has a neurodevelopmental cause.
Use of medications as adjuncts to support learning.
So considering the fact that a lot of our children with special needs have their difficulties stemming coming up from a brain that is biologically not very normal, okay, or yeah. So it is logical to think that we can also use a biological way to help change some of this abnormality in the brain, okay, to make it function better. It's a bit like an engine in the car that is not running so well, so we put in some oil, okay, to get it to run smoother. Next.
Risperidone drops in ASD. Self-injurious behavior, aggressive behavior, sleep difficulties.
Children with special needs, sometimes parents will complain that they have difficulty controlling their emotions. When they get angry, they will hit other children. Not all of them, but some. Okay, or some of them, when they are irritated, they will bite themselves or self-harm. One medication I find very useful for these children is the risperidone solution. It comes in a in a solution form, colorless, odorless, tasteless, and I only give them 1 drop a night. Okay, 1 drop into their Milo or milk, and in many cases it actually helps a lot. The child becomes calmer. They don't self-harm. They stop hitting others. So it helps the child a lot to function much better, and they can go back to studying.
Methylphenidate or Ritalin for ADHD stimulates the prefrontal cortex and improves self-regulation.
You remember the picture of the policeman, okay, who has gone to sleep in children with ADHD? Methylphenidate is a stimulant medication. This is a very old medication. Yes, was discovered in the 1950s. So it's about 70 years old. Such an old drug is actually very safe, because any drug that can cause any serious side effects would have been taken out of the market. But over the past 70 years, methylphenidate, or the shorter or the more common name for it, Ritalin, has been used and is still the first line treatment for ADHD. So this medication we use to so-called wake up the policeman in the child with ADHD. So when the policeman wakes up, the child is more able to regulate themselves, more able to self-control, more able to focus, more able to listen to the teachers. And what happened is teachers find them more able to study. Teachers are happier with such children, and the friends are also happier with them. So they have better friends, they have more friends, they do better in studies. So it's quite helpful. Next.
SSRIs for excessive obsessions and irritability.
Some children with special needs, especially children with ASD, okay, autism spectrum disorder, they may have some obsessions. They want certain things this way and not the other way. They are very rigid, and if a little bit of this is fine, you can continue with their studies, continue with their daily life. But if this is very in the extreme, when it affects home life, it affects life in school, then we can consider giving them some medication. The medication we give is the same medication we give to people with obsessive compulsive disorder. So the SSRIs are the drugs that we use. Examples are Prozac, Lexapro, and so on.
Antidepressants for severe depression and post-traumatic stress symptoms.
Children with special educational needs, many of them actually are under quite a lot of stress. They know that they are different. Many of them knows that they are different from other children. They are sad that they don't have many friends, or people don't want to be their friends. They get bullied by other people. So many of them develop depression as a result. Some develop post-traumatic stress disorder, especially those who are being bullied or scolded in the extreme way. So such children, if they are overly depressed or overly affected by traumatic incidents, so medication can help to lift them out of those difficult feelings and emotions. So antidepressants like Prozac can help with such children. This a lot of parents are worried that once they take medication, they will be reliant on it for life. That is not true. Antidepressants are given usually only for 6 to 9 months. Once the depression lifts, we can actually consider stopping the medication.
Antipsychotics, example, Abilify for auditory hallucinations and fixed false beliefs.
Some children with special needs, as they grow older, when they reach teenage years, may develop some hallucinations, like they may tell you that they hear some voices, or they tell you some strange kind of experience, like people are talking bad about them, or there are people following them. So such symptoms, if they get too much, that there are medications to help them. Okay, antipsychotics like aripiprazole can be used to treat such children. Again, they don't have to be on this for life. Usually for a few months to a year, if the symptom disappears, we can slowly cut off the medication. So the medication I have mentioned so far is actually used as an adjunct. Adjunct means we use when necessary. We use as a on the side kind of support. Okay, so like I said, the main way of helping such children with special needs is behavioral and educational. And if they have other difficulties, symptomatic difficulties, which medication can help, then medication ought to be used to help these children.
Hypnotics, example, melatonin and zolpidem to help with sleep difficulties.
And for children, some children who have difficulty sleeping at night, there are medications like melatonin, zolpidem. There is an antidepressant which is sedative called Remeron or mirtazapine, which can also help such children. So there is a whole range of medication, and parents need to not just see medication as an enemy, but I think more as something that they can use to help their child if necessary. Okay? So it's like, again, the 3 legs in the stool. Don't take away one leg from the stool, otherwise the stool won't stand as well as it should.
Other biological methods, EEG neurofeedback for ADHD and sleep disorders, and EMDR for traumatic memories.
This is, I think, my last slide. So besides medication, there are other biological methods that can help children with special needs. One recent one is EEG neurofeedback, where a child, we link up the child to a computer. They wear something like a helmet with wires that link to the computer, and we get the child to play some computer games with their mind instead of their hands. So they focus on the game and they control the game by thinking. So this EEG neurofeedback actually trains the children to increase certain waves that are helpful for them. Okay, it's especially useful for children with ADHD. Okay. And it helps also people with sleeping disorders. Other techniques like EMDR, eye movement desensitization reprocessing, is useful for children or adolescents with traumatic memories. Okay, if they have been they can't forget being bullied or being put in a spot or shamed, then this technique can be useful for them. Okay. So
these are the references, 4 different articles.
Okay, so if you are interested, you can have a look at these articles. So thank you very much. Hope you have a nice conference. Finish.